Hi, I'm Danielle Matias at Caring Medical. Today I'm going to talk about knee pain specifically related to the peroneal nerve. Now, your peroneal nerve is actually located on what we call the lateral side of the knee, so the outside part of your knee. If we look here, here's your tibia, this is your fibula, again on that lateral part of the knee, and your peroneal nerve comes right around here, right around that outside of the knee, and then branches into what we call the deep and superficial segments. Now, patients that might have chronic lateral knee pain, there could be a variety of causes. Patients could have, meniscal tear, or they could have ligament injury to that lateral knee. But in cases where patients, they don't have any kind of meniscal tears or maybe even arthritis, we look at their ligaments, they connect these bones here. They look stable, they look strong on ultrasound, but they have this chronic pain that maybe even radiates down towards their foot. Oftentimes, this actually can be irritation from this nerve. If we look here, again, this is a view of the leg from the front. There's that common peroneal nerve, and then if you look here, this is that superficial and then deep. So that nerve, as it branches, is going to innervate, two different parts of the skin. So patients that have numbness, maybe burning, tingling, any of those kind of nerve-related symptoms in that distribution can have injury or swelling or any kind of insult to that peroneal nerve. Now, in some patients, maybe that instability on that knee, that extra motion of that knee is banging on that nerve, causing that symptoms. But I recently had a patient who underwent actually a knee replacement surgery, and after the surgery had this new onset of this lateral radiating pain. He didn't have that before the surgery. After the surgery, he had it. And again, we're not worried about anything inside the joint causing pain. He had all that replaced. His ligaments looked really good on ultrasound. There wasn't any kind of instability there that would suggest any bone rubbing on the nerve, but ultrasound showed that that nerve was really swollen. So at some point, he got some kind of injury to that nerve. In that patient, we did a hydrodissection procedure where we injected both 5% concentration of dextrose and PRP, cells from that patient's own blood, around the nerve with ultrasound guidance. And by the next time I saw him, in 3 weeks, the pain was 50% better. He could walk better. He wasn't getting as severe of that pain. And so we repeated the procedure and expect him to continue on with great results. This is actually a graphic showing hydrodissection of a nerve under ultrasound. So here's the nerve, this is the needle, and then we inject a fluid. We don't go through the nerve, but we inject a fluid around the nerve to free it up from any kind of constriction. That little bit of sugar in the 5% dextrose will draw swelling off the nerve, pretty much help it to kind of reset. PRP around the nerve also works really well. That's your own cells working to heal nerve injury, any nerve injury that could be present there. So in cases where patients come in, again, with this maybe unrelenting lateral knee pain that's radiating down towards their foot all along the front of that shin, hydrodissection procedures for the peroneal nerve work really well. Now, had that patient also had lateral knee instability, we would have also treated those ligaments with prolotherapy to strengthen those tissues, get stability of the knee, and then also get the pressure off of the nerve.